So, we are answering many frequently asked questions related to liposuction, and one of them is, can liposuction treat visceral fat? In this video, we will be discussing about visceral fat, subcutaneous fat, what does liposuction do, how we can reduce our visceral fat, and how to embark on our journey for liposuction surgeries. Hi, I am Dr. Hiranmayi Jha. I am an aesthetic plastic surgeon practicing at Eterna Vision and Aesthetic Clinic located at Shivalik, Malvinagar, South Delhi, and today we are discussing, can liposuction treat visceral fat? So first let's discuss what is visceral fat. Visceral fat is the fat which is present in our abdomen or intra-abdominal fat. That is the fat present around the organs. However, subcutaneous fat is the fat which is present in the superficial layers of our body, and liposuction is basically targeting our subcutaneous fat which is present in the superficial and deep layers of our subcutaneous tissue. So, liposuction as such does not have any role in targeting visceral fat. But what is visceral fat? What are the signs? What are the consequences of having more visceral fat, and how can we get rid of it? So, the fat which is present inside the abdomen can lead to serious consequences like cardiovascular diseases, or in cases of hypertension, or in cases of metabolic syndrome when the body has high blood sugars, high blood pressures, and in those conditions we see that the person has a pear shaped body, the fat is dense and firm, and this fat cannot be treated by liposuction. So then the question arises, what should we do for it? So for visceral fat, the best ways how you can reduce it is by diet. Diet which should contain whole foods, lean proteins, and less sugars. Now exercises. Exercising 150 hours a week has been shown to decrease the level of visceral fat in the body. Now strength training exercises, exercises which involves using some amount of weights for our muscle training, which goes and reduces the fat, basically the visceral fat, as training your muscles with weights increases the basal metabolic rate throughout the day, and as such it decreases the visceral fat. Now reducing stress levels. If you have too much of stress, it increases hormones in our body which are bad, such as cortisol and insulin, and these go and again increases the visceral fat in our body. Having adequate amount of sleep has also shown to decrease the level of visceral fat in our body, and at least 7 to 9 hours of sleep is recommended to give the body sufficient time for relaxation and to have a good complete control of our metabolism. So these are the ways, and these are the various ways to reduce your visceral fat in the body. And when you are embarking your journey for liposuction surgery, so you have to keep in mind that liposuction is basically meant for individuals with ideal body weight, with small amounts of stubborn fat pockets, and who are close to the ideal BMI. Now there are some indicators which like give you an alarming signal that you could not be a candidate for liposuction, and these are like having a waist size more than 40 in males and more than 35 in females. Now here there are chances of having more of visceral fat than your subcutaneous fat, and in those conditions you should go for you should not opt for liposuction surgeries. Rather, you can have a combination of both. You can target your visceral fat by the ways which I mentioned earlier, and liposuction for your subcutaneous fat. So this is the best way by which you can choose your body contouring surgeries. And if you have any doubts regarding the topic, you can write to us in the comment section below. Subscribe our channel to get notifications about the subsequent videos about the cosmetic and plastic surgery procedures, and Drop in your comments for any queries that comes to your mind. Thank you.